When young women are diagnosed with breast cancer, they face the same things as older women, but some issues that are either harder because they're young or are unique to young patients. One of the major areas, it has to do with fertility and fertility preservation, and we wrestle with this issue with our young patients for lots of reasons. And one of the areas that's particularly controversial is preimplantation genetic diagnosis, which is essentially determining from an embryo, if a woman undergoes IVF and then has it fertilized, when it's at the embryonic stage, before it's been matured into a child, if that's going to happen, to determine whether or not that fertilized egg or embryo would carry a breast cancer predisposing gene, for example, a BRCA1 or a BRCA2 mutant gene from the affected mother, presumably. That's why it's an issue for our young breast cancer survivors. So this is something that is available. Our reproductive endocrinologists and reproductive biologists have figured out how to do this relatively safely, and yet it's expensive. It's stressful for patients to go through IVF, especially some of the youngins that don't need to medically because they're not infertile often after their chemotherapy, because some of them are just so young it doesn't affect their fertility, at least short term. And then finally there are the ethical issues of, would you not grow up an embryo that might be just like you? And are you playing God or something else like that? So these are big issues. And then of course, what do you do with the embryos? Another big issue from a societal and ethical standpoint. So these are things that the young women and their families face when they're diagnosed. In some ways, it's great that we have this technology to offer, but it is quite controversial.